Assalamualaikum warahmatullahi wabarakatuh. Hello, my name is Isna Lailatul Maulidiyah. I'm studying in Healthy Polytechnic Semarang, and I'm from Diploma 3 Blood Bank Technology. This time, I will explain to you about hemophilia in children.
Okay, there are several points that we will discuss. Number 1, understanding hemophilia in children. Number 2, causes hemophilia in a child. Number 3, the symptoms of hemophilia in child. Number 4, hemophilia diagnosed in a child. Number 5, hemophilia treatment in child. Number 6, possible complication of hemophilia in child. Number 7, how can I help my child live with hemophilia? Number 8, when should I call my child's healthcare provider? Number 9, key point about hemophilia in child.
Hemophilia in children. What is hemophilia in children? Hemophilia is an inherited bleeding disorder. Children with hemophilia can stop bleeding because they don't have enough clotting factor in their blood. Clotting factors are needed for blood to clot. Blood clots to prevent excessive bleeding. There are many blood clotting factors involved in the forming of clots to stop bleeding. There are two common factors that affect blood clotting. These are factor 8 and factor 9. Next, causes hemophilia in children. Number 1, a female carrier has the hemophilia gene on one of the X chromosomes. When a hemophilia carrier female is pregnant, there is a 15-15 chance the hemophilia gene will be passed on the baby. Number 2, if the father has hemophilia but the mother does not carry the hemophilia gene, then none of the sons will have hemophilia disease, but all of the daughter will be carrier. Number 3, carrier of the hemophilia gene often have normal level of clotting factor, but may bruise easily, bleed more with surgery and dental work, have frequent nosebleeds, have heavy menstrual bleeding. Hemophilia C usually does not cause problems, but people may have increased bleeding after surgery. Next, the three main forms of hemophilia include hemophilia A. This is caused by a lack of the blood clotting factor 8. About 9 out of 10 people with hemophilia have type A disease. This is also referred to as classic hemophilia or factor 8 deficiency. Hemophilia B. This is caused by a deficiency of factor 9. This is also called Christmas disease or factor 9 deficiency. Hemophilia C. Some doctors use his term to refer to a lack of clotting factor 11.
The symptoms hemophilia in child.
Number 1, bruising. Number 2, easy bleeding. Number 3, bleeding into a joint. Number 4, bleeding into the muscle. Number 4, bleeding in the brain. And last, other bleeding. Next, hemophilia treat in a child. Treatment may include bleeding in the joint, may need surgery or immobilization. Your child may need rehab of the affected joint. This may include physical therapy and exercise to strengthen the muscle around the area. Blood transfusion may be needed if major blood loss has occurred. This is when your child gets donated blood. Self-infused factor 8 or 9 can allow a child with hemophilia to lead a near normal lifestyle. The diagnosis of hemophilia is based on your family history, your children's medical history, and a physical exam. Blood tests include 1, complete blood count, clotting factor, bleeding time, and genetic order in testing. The next topic is possible complication of hemophilia in child. What are possible complications of hemophilia in child? Complications of hemophilia can include bleeding in the joint or muscle, inflammation of the joint lining, long-term joint possible, very serious tumor like enlargement of the muscle and bone, development of antibodies against clotting factor, and then infection from transfusion. How to maintain the health of children who suffers from hemophilia? Number 1, letting your child take part in activity and exercise, but not unless they may cause injury. Number 2, not giving your child aspirin or other non-steroid anti-inflammatory drug. Number 3, preventing dental and gum problems with good dental hygiene. Number 4, wearing medical identification in the case of an emergency. Number 5, getting vaccines under the skin instead of in the muscle to prevent bleeding in the muscle. Healthy provider. When should I call my child healthy provider? When you should call will vary based on how severe your children's condition is and what treatment he or she is getting. Call your children healthy provider if your children 1 is injured, 2 has pain, 3 has bleeding that you cannot control, and then is scheduled for surgery or another procedure. Key point about hemophilia in children. 1. Hemophilia is an inherited bleeding disorder. It causes unaffected children to have low levels of blood clotting factors. Number 2, the most common symptoms of hemophilia is increased uncontrollable bleeding. And number 3, giving factor 8 or 9 can allow a children with hemophilia to lead a near normal lifestyle. Guys, thank you for watching my video and see you next time. Bye bye.